Hi, I'm David Pope and this is Achilles Tendinosis in runners, part 1 of 2. This time we're going to look at assessment and differential diagnosis of Achilles tendinosis, and next time we're going to look at treatment of Achilles tendinosis. So this is presented by Russell Wright and brought to you by Clinical Edge.
Hi, I'm Russell Wright from Central Coast Foot and Ankle Physiotherapy. One of my passions is running, and I love the challenge of picking up biomechanical inefficiencies in other runners. So today we're going to talk about Achilles tendinosis in runners. Firstly, we'll look at biomechanical considerations and then how to assess your runner, and then treatment strategies for your runner with Achilles tendinosis. One of the major biomechanical considerations you need to make with your runner, your injured runner, is their stride length. Stride length is probably the biggest, most common problem in running injuries, and it's not a small problem because reports have shown that up to 75% of people every year will be injured who are runners. So stride length, the term that people commonly use is overstriding, or sometimes an overextended runner. This happens when your foot strikes in front of your centre of gravity. So when your foot strikes in front of your centre of gravity, you end up with a more straight knee and landing on the rear of your heel, as opposed to landing like this when you end up with a flexed knee and with more of your weight forward on your heel. So essentially what you're doing when you overstride is you're applying a braking force into your running motion, because the ground reaction force has a horizontal vector against you. So what we're trying to do is take away that force coming against you, and the road force then just holding you up rather than pushing against you. In the position where your foot is in front of the centre of gravity, you end up pulling forward with your hamstrings rather than using your glute max on the opposite extended leg to push forward. Obviously, glute max is a lot stronger and well suited muscle to be using repetitively with running. Now, when your foot lands in front of your centre of gravity, you can potentially overload your Achilles, because the time your foot is in contact with the ground is extended, and this leads to your Achilles, your triceps surae muscle group and your Achilles to have to eccentrically control throughout a longer phase, as opposed to if you land with your centre of gravity over the top of your centre of gravity, then there will be less eccentric control work and less shock absorbing needing to happen.
This runner is demonstrating a good technique where his foot is landing under his centre of gravity. The centre of gravity is usually around his navel. He gets his knee flexion quickly before landing and has trained to do this with sprinting running drills. From the frontal plane, he gets his foot down quickly, so you don't see the sole of his shoe for long. This runner has an overextended pattern. You can see her foot lands on the heel with an extended knee.
So a change to your technique will improve your running efficiency, and your patients will love you for this because they'll also be less injury prone, get better times, or be more comfortable running longer distances. Okay, occasionally you will get an overflexed runner. An overflexed runner looks like they are sitting down to run, or kind of like a Thunderbird walks. The problem there is that usually they don't have as much inner range strength in their quads and glute max to control themselves, so therefore they use their mid-range strength by sitting into it more. Today we're going to focus on the overextending runner though.